Hello. This last recording is going to focus on the role of the PTA. So you've already seen the evaluation of the PT or the evaluation or examination done by the physical therapist and what these elements are that the PT looks at in regards to the patient that has a neurological health condition and neurological impairments. Cognitive, mental status screening. These are elements that you're familiar with in terms of the ANO, in terms of cognitive status, and as well as communication. You're starting to learn about different speech and communication problems. You were introduced to them in PTA 100 when you studied the neuro section in terms of being able to speak or having some speech difficulties. You learned some terms called aphasia. And then the other component that is new to you, or at least less familiar, you have been exposed to this term in PTA 100 and certainly in PTA 101 in lab, and you're already doing this, whether you know it or not, is motor learning. So motor learning is the ability to just learn new information in regards to your musculoskeletal system, your neurological system, which those two systems work together to produce movements that are something that is reproducible, such as rolling to the side of the bed and doing a log roll, being able to do a pelvic tilt, for example, or being able to put full weight through your limbs, whereas before you had you were not, or the patient was not able to put full weight through that limb because of, in this context, a neurological problem. And then the process of being able to reproduce that movement and being able to do so with less cueing is part of that process of learning. But then it finishes up with motor control, being able to do it automatically versus needing that feedback. And then we've talked about posture, balance, and coordination. So this information is not new. That is not new information for you. So I'm going to just share with the references that I'm talking about. You see these below. And then let's get into the role of the PTA to mirror or take from the examination or the evaluation and to include it in some interventions. So we're seeing motor and monitor and report physiological response to interventions. This is something that you've learned and have been doing in terms of lab, in particular with the cardiovascular patient, the cardiocompromised patient with variable vital signs or unstable vital signs. Motor control and motor learning, we talked about that. And then to being able to communicate in a timely way challenges that you have with that particular patient, or just not understanding fully what's happening. It's okay, even for seasoned PTAs, if something isn't quite adding up, to go to the supervising PT and ask for clarification or to communicate. I don't know, they're not following that predictable pattern in regards to presentation for this type of injury to the neurological system, such as the ischemic stroke affecting this particular middle cerebral artery. They're not following the presentations that I would normally see with someone with a left-sided CVA, for example, in terms of impairments or perhaps even progression. So that is where you want to do a timely communication with the supervising PT to ask questions and to get some clarification if you're not sure. And that's important. Or if you see a significant change in that patient's ability to follow that predictable pattern, they're not following it, that is a communication to the PT. And these other interventions you already know. It's just going to be a little different with someone with a neurological problem. So really embrace this section. I think is quite rich in terms of content. Some of the things you haven't had much experience with and you'll have next fall in PTA 204 lab is sensory training. So know that. And that's not, I'm not expecting you to know that at this stage of your learning, but we're giving you an example. And then using a lot of different pieces of equipment. You haven't had that exposure yet either. That is to come. So know that. That would be including, like, for example, a standing frame. You have seen some of this equipment a little bit in terms of the patient in the ICU, Phyllis, but certainly not to the extent that you'll see in lab next fall. So that is to come. But this information will be helpful when you provide a treatment plan for MK, which is your last signature assignment for this course that isn't due till later this term before finals. Okay, that's it for now.